Hello, my name's Kamina. I'm going to be your nurse today. Miss Marilyn Hughes, we're going to just go over, I know the doctor is starting you on heparin, so I'm just going to give you a little bit of patient education and a little bit of teaching, okay? And some things to look out for. So first, I would just want to let you know that heparin is preventative care for clots. So it's gonna prevent. I know you had your that open surgery on your left mid shaft. So doctor just wants to make sure that you don't have that you don't develop any clots. So that's what heparin. That's how heparin comes into play. It makes sure that your blood does not clot. It doesn't break up any clots, but it just makes sure that it's preventative care for clots. So with that said, some main things a major thing you want to watch out for is bleeding. Because you're on heparin, your blood is actually is thinner. Your clot time is you're not clotting as fast. So for example, if you cut your if you get a vaccine in your arm, you're gonna bleed a lot more, and it's gonna take a lot longer for it to stop bleeding because you're not clotting faster, because you're taking heparin. So again, you want to make sure you're looking out for bleeding. Easy bleeding is a normal side effect. Longer clotting time again is a normal side effect. And sometimes even like redness at any injection sites, that could be a side effect as well, which is why when I go over the injection process, you just want to make sure you're rotating sites so that you're not constantly injecting that same site. But we'll go over that towards the end as well. So I want to also go over some adverse effects that you want to look out for, meaning like if there's any like major, again, we're looking out for any bleeding. We're looking out for any signs of bleeding. So make sure you're when you have a bowel movement, make sure that I know it's kind of weird, but make sure you go and you look in the toilet to see what your bowels look like. If you don't do that on a normal basis, you want to make sure you're doing that when you're taking heparin, because you want to look out for any like black or tarry stools, because that can be a sign of bleeding. Also, when you're brushing your teeth, try and use, or you want to make sure that you're using soft toothbrushes. I know they have the soft, medium, and hard when it comes to toothbrushes. So you want to make sure that if you don't have a soft toothbrush, you want to go ahead and invest in that. Something that you can get from like the dollar store or your normal CVS or Walgreens, not too expensive. But you want to do that because the soft toothbrush is going to limit the bleeding from your gums. So that a lot of times like the medium or the hard toothbrushes are kind of rough on the gums, and you don't want that because again, you don't want any bleeding. Also, when you're going back to the restroom, when you're urinating, you want to make sure you're looking at your urine, make sure there's no blood in your urine. It could be pink, red, so just make sure that you don't see any signs of blood in your urine. You also report if you're having any chest pain. Just make sure you're reporting that. That's something you want to go to the emergency room or your doctor for. And then, or any signs of like, if you're having any severe headaches, you want to go to the emergency room, because that's something that you want to report to your provider as well. This can be a sign of like a head bleed, so just make sure you're reporting that as well. And then going back, I kind of like talking about the adverse effects and and we're talking about your lifestyle changes as well. So again, investing in that lifestyle, in that soft toothbrush. Also, you want to refrain from any like contact sports if that's something that you do outside outside, you want to make sure that you're not doing that, because again, we want to reduce the risk of bleeding, and contact sports can cause bleeding. Also, avoid any NSAIDs or aspirin. Those are known to cause bleeding. So make sure if you're taking any over-the-counter medication, always double check with your doctor, because some of those medications can have aspirin in it, or they can just counter interact with the heparin. So you just want to make sure that your doctor knows any new medication, any current medications that you're taking. That's going to be the best thing that you can do. So now we're going to go over, you have your pamphlet that I gave to you that's going to go over, that explains everything that I just discussed with you. But right now what I want to do is I want to do a quick self-injection teaching. So I'm going to go ahead and demonstrate it, what you'll do, and then you'll go ahead and perform it. It is going to be time for your first dose of heparin, so we're going to have you go ahead and perform that on yourself, okay? So the first thing you want to do is you're going to make sure you cleanse your hands, and then you can either do it sitting up or lying back, whatever is comfortable for you. I have my pen that I'm going to go ahead and use to do my demonstration for you. So you're gonna go ahead and choose if you want to sit or lie back. You'll go also when you're choosing your site that you want to administer the heparin, you want to do it 2 inches away from your belly button, okay? Your umbilical region. So on the paper is some sites where you can go ahead and administer it. Right now, go ahead and do it on my right hand side for the demonstration process. But you want to make sure you're switching that up, not using it at the same time like mentioned previously. So go ahead and cleanse the site with the alcohol pad. After, you're going to go ahead and pinch the site. And you're going to insert the needle at a 90-degree angle, just straight up. And then when you insert it, and then you push down on the plunger, you don't want to aspirate. So just go ahead and push down on the plunger, and then you're going to pull the needle out at the same angle that you came in. Go ahead and activate. There's a safety, I'll show you where the safety feature is on the needle. You'll go ahead and activate that, and then discard of it. You'll have a personal like red biohazard trash can that will go ahead and give you to dispose of your needles in. And then you don't want to massage the site or anything. So that's how you'll go ahead and demonstrate the heparin. Again, if you have any questions, or if you do not understand anything, feel free to always call your nurse, or your doctor will go ahead and explain anything to you. And then so now we'll go ahead and have you perform your first heparin shot, okay?